My name is Moises Verdejo and I am a ROP student. I am representing Baldy View ROP. My class is the Registered Dental Assistant class and my instructor's name is Miss Carolina Vasquez. My class forms part of the Health Science and Medical Technology industry sector. Throughout this program, I have developed skills in the field of dentistry. These skills come from charting, sterilization, and also kernel polishing, sealants, and in the future radiology, among others. Also taking alginate impressions. And out of all of these skills I obtained, alginate impressions is the one that I mostly had most fun and really interests me on how to perform these alginate impressions. So with the alginate impressions, it is always very important to have appropriate PPE, which are the gloves, the goggles, and the mask as well as the lab coat. And this is important to protect ourselves as dental assistants and to protect ourselves from any injury that can occur in the workplace. For the alginate impressions, we have the alginate powder, and we also need water. We also have the trays, which is the mandibular and the maxillary tray, as well as the mixing bowls and a spatula. So to begin with, you fluff the alginate, and you fluff it to make sure everything is well mixed. When doing the impression for the mandibular tray, it's important to keep a correct ratio of 2 scoops of powder to 2 scoops of water as well. And it's important to mix the powder into the water instead of mixing the water into the powder to avoid having difficulties. So once you have the correct ratio mixed into the bowl, it's important to spatulate correctly. Once you have an appropriate mix, it's important to place it in the tray before it sets. It usually sets in 1 minute, so it's important to place it on the actual tray and then place it in the patient's mouth. Once it has set and you have tested it with your nail that it has been set, you can remove it and make sure that all the margins are set on your tray. Now for the maxillary tray, it's important to do 3:3 ratio of powder and water because you don't have the tongue, therefore you need more actual material to cover the rest of the palate. And you follow the same structure of the same steps of mixing and then placing on the tray and also placing therefore on the patient's mouth and waiting for it to set, testing with your nail, and then removing and checking that everything is done correctly. Now once the impressions are taken, it's very important to spray them with Cavicide to disinfect them and wrap them in paper towels, wet paper towels, to keep them moist and avoid drying. This is just something I wanted to share throughout the different skills I've obtained. This is one that indeed is very interesting to me. And this program, Baldy BVROP, the Registered Dental Assistant program, have helped me decide that dentistry is my true calling. And I definitely want to excel in this career. For future goals, I want to be a hygienist and continue excelling in my career. I would definitely recommend this program to friends and family, and indeed I have recommended this program because it's an excellent program that helps you decide what you are truly passionate about and helps you to be completely decided that what the career path that you chose is the career path that you want to follow throughout your entire life. And for me, this Registered Dental Assistant class has provided many benefits in deciding what I want to do to the future, which is becoming a hygienist and excelling my dentistry career from there.